Good evening from India. Like Anshu said, my name is Meenakshi Gupta. That's how you pronounce it, and you did right. I am the co-founder of Goonj, a non-profit based in India, which has been working on diverse disasters across the country for the last 20 years now. Welcome to this session on crisis and disaster response. Today, we will be discussing an important question that must be on the minds of half the humanity right now. And that question is that how do we ensure that we are all properly prepared for the future crises and disasters? And I say half the humanity because a big majority is too occupied with the question of their survival without a roof over their heads or food on their table or the privilege of being connected to the world the way we are and to be able to share their challenges. Before I introduce my co-panelists, I would like to share some questions which I hope will help us use the next 90 minutes in a way that we have some specific takeaways from this discussion. COVID has, for the first time, impacted people of all strata across the globe, whether in the developing or developed or emerging, etc., economies. And being a part of Catalyst 2030, which is a global alliance for social entrepreneurs, which has come together, I noticed that world over, the social entrepreneurs and the civil society has responded in a phenomenal way to this pandemic, literally dropping everything they were doing in the last mile frontline work of keeping just people alive, feeding them, surfacing their issues, and evolving innovative solutions by collaboratively adapting and strategically applying their limited resources and manpower for the most vulnerable communities all across. So one question is that when we are talking about disaster preparedness and response, how do we learn from these voices, these experiences and expertise at the ground level and get that thing gets reflected at the policy level? Also, I often hear this analogy that we are all in this storm together when we're talking about COVID. And it shows how connected we all are as humanity or as a planet. But it also raises the question, do disasters impact us all equally? And how do we ensure that the response and preparedness prioritizes the most vulnerable or the inequalities in our society? I have with me an esteemed panel to go over these and other important questions about what we need to do. So let me start by introducing my co-panelists. I'll start with Mr. Patrick Krens. He's the Executive Director of Child Helpline International. He comes with more than 20 years of experience in the NGO world as a senior consultant and a fundraiser. And Child Helpline International is an international network of child helplines. It's a global collective impact organization with 173 members in 142 countries and territories around the world. Next, we have the pleasure of having Professor Anil Gupta. He's a very eminent Indian scholar whose body of work, among other things, has been on the area of grassroots innovations. He's the founder of Honeybee Network. He's executive chair, vice chair at the National Innovation Foundation, and a fellow of the World Academy of Art and Science. I'm very proud to say that we are happy to have him here. He's also received one of the highest honors in our country, the Padma Shri, for his contribution to the management education. And our dear friend, Bill Toliver, he's the founder, executive director of Batali Line. He's the chair of the board of directors and acting CEO at Resource Alliance. Bill has been helping nonprofits, foundations, and social enterprises reframe their approach to strategic decision-making, resource development, and communications. And Resource Alliance works globally to strengthen the social impact sector by helping organizations to develop the critical human, financial, and intellectual resources necessary to build a better world. And last but not the least, my partner in crime, Anshu Gupta. He's the founder of Goonj. He's an Ashoka and Schwab Fellow. He's also a Raman Magsaysay awardee. Under his leadership, Goonj is credited with transforming the culture of giving in India. And he is focused on highlighting dignity over charity as a lens for development work. And Goonj is using the underutilized urban material as a tool to trigger development with dignity across the country. So I will start by asking all of you a few questions and also try and include questions coming from the audience. So my first question is to all of you. coming from Asia and in many other countries, in many other parts of the world, we see that some disasters like floods, like droughts and all are like annual rituals. They have a very predictable pattern, very specific geographies. We even know the timeline in some of them. And then there are some disasters which are unprecedented in nature, like COVID, which we've never seen before, and which I think many of them are coming from as a result of climate changes. Now, my question to all of you is, what are some of the recurrent unaddressed challenges that you've seen come up again and again in disasters which have not been resolved? And I'll start with Patrick, if you can, if I can get your response to this question, and I'll ask all other people, whoever wants to speak after you. We can start with you, Patrick.
Yes, of course. Thank you so much, and welcome everybody to this very special roundtable. I guess that I call it, let's say, the disaster within disaster phenomenon, meaning that if indeed a certain disaster occurs somewhere in the world, then a big magnifying glass is put over it, and then all kinds of underlying disasters will pop up and will be enlarged somehow. We as a network of helplines all over the world are witnessing that right now with the COVID-19 crisis, where actually a lot of, I would call them continuous disasters, are popping up. For example, issues related to child sexual exploitation and abuse, that has been there all the time, and which is being enlarged during COVID-19. So a lot of calls from children and young people that our members get all over the world are related to an abusive or violent situation at home, especially now with the lockdown in so many countries. So that is something that is very specific now during the pandemic, but the disaster within disaster issue has been there for many years. And another thing I would like to mention here is the disconnect, I would say, sometimes between being prepared, the preparedness, and the response of a government or social entrepreneurs or by civil society. Also here, COVID-19 is rather an exceptional case. Nobody 2-3 months ago would have been able to predict the outcome and impact of the COVID-19 pandemic. We were not prepared as a world, I would say, to take action in an immediate and serious way. You can see it at the different protocols, the different measures that are being taken on a national level. Differences are big. And also for our members, for example, the helplines, they all react in a different way. Some are able to cope with it. They are able to scale up their services. Others have to bring their services down or even to close their services, which is rather a big concern for us, of course. But what you also see, and that's maybe a learning point, but it keeps on repeating itself in terms of disasters, is being prepared by means of a contingency plan, for example. What we found out in a very quick needs assessment at the beginning of the pandemic, especially in Africa, there were many members that did not even have a contingency plan in place. So that was rather worrisome and something that we have to act upon.
Thank you. Yeah, I mean, I think whether it is a disaster or even as an organization, I see the absence of contingency plans is something that as a country, as an organization, as global, I think that kind of planning is what you're saying that needs to come into place. I'll come to Bill right now. I'll just try and get a sense of what does the worldview on how are you looking at disasters happening time and again, and the issues that are emerging?
Thank you so much, Minnie, and I'm honored to be on the panel with these esteemed colleagues. I guess that, I have struggled many times about this notion of disaster as a separate entity, as a separate issue from all the rest of the issues that we really deal with on a daily basis. I think that a disaster, frankly, is part of the human condition. It happens in life, and whether that's a crisis of suicide or whether it's an immediate disaster from a natural event or something like that. And so to me, what I find with this whole notion of disasters is, though it is a part of our human life, our entire approach to disaster relief and disaster preparedness and everything else is transactional. If you sort of think about how we raise funds, if you think about how we communicate with the public, it's really always very reactive and transactional. So, to think about what Patrick just said, in some respects, I will never use the word blame, but I lay the responsibility for that reality at the feet of people in the position to affect things. And so I think, to the extent that we continue to make our funding and our resource allocation transactional and reactive, then people tend to think of disasters in that way. In reality, what disasters do is they shine a bright Klieg light on the inherent flaws of what we have in place in the world. And so a disaster tends to be more of a disaster because of two reasons. Number one, because those people who are already impoverished, as Patrick was saying, suffer greatly. And for a brief moment, it becomes something that is suddenly made visible to all of us. And then secondarily, it shines a very bright light on the woefully inadequate response system we have in place. So when you think about it in those ways, a disaster just simply shines a bright light on the two inherent failures, one being that we still have a massive gap between the haves and the have-nots and the fortunate and the unfortunate. And then secondarily, we still do not have a system in place that is particularly effective at responding to these sorts of things. So I guess, I don't want to say that in a particularly judgmental or negative way, but I think we have to rethink how we frame the notion of disaster. It is a part of the human condition and is going to become an ever greater part of the human condition. So how do we communicate with humanity to help them put disaster in context?
Thank you, Bill. I think it's important to have the correct questions being asked for the answers to really emerge. And I think I'll go to Anshu now. And Anshu, I'll bring you the same question about you. We've been working on disasters for the last 20 years. And India is a very good example of, it's a microcosm of many, many cultures and geographies and the kind of disasters that we've seen. And Gunj has worked on almost every possible kind of disaster that you could think of. What have been the constant or the similar kind of issues that you've seen reoccurring?
So I think, COVID that way has exposed the society, and it's not about India, but the world over, that how have we been treating the human being, or what has been the approaches which have gone wrong. How, for many years in my all sessions, I have been saying this again and again, that poverty is one of the biggest and the ongoing disaster. I mean, why do you think that earthquake, flood, and now COVID is a disaster? At the end of the day, even in this particular disaster, it has actually divided the world in two parts. The world which has food and the world which does not have food. And the people who do not have food are actually outside the walls, and the people who have food are inside the walls. So it is ultimately comes down to the poverty. And I remember, reading somewhere or listening to someone who actually said that relief is a much bigger disaster than the actual disaster often. And that's what we often see. And that's what, at Gunj also and other institutions also, we have been struggling, that why it is important to maintain the dignity of people. I mean, and this particular disaster, again, I'm saying COVID is exposed, which is really told us that we are so careless about the dignity of people. I mean, there are enough pictures which we see from world over how people are going to some person who was earning well, but because of the lockdown and all suddenly became, momentary, maybe poor, financially poor, and you are giving some half a liter milk or one packet of sanitary pad, and then how you're posing with that person and exposing it everywhere. So I think what we have not learned and what has been the biggest failure, I would say, I will talk about a lot of positive things in the next half an hour, 40 minutes for sure. But I think at the base of it, we, for many of us, it's a very sad feeling that what happened, what has gone so wrong, that people are in such huge miseries. How come people like us couldn't do much about it? I mean, as Bill, referred, we all are the powerful people, so-called powerful people. We sit in the conferences and decide the fate of people. We sit in the big houses and all and decide on what is to be done. And, so I think somewhere we have gone wrong. So in my opinion, some of the points, if I see the disaster, for sure, we have never considered poverty as an ongoing disaster. Relief is becoming a big issue because we are not understanding, we are still using our distorted lenses to see the problem and find the solution. And again, we are using our distorted and long language in delivering certain, or maybe standing, with people. And also maybe, the people like us, somewhere, the people who we are good close in my language, if we really, this is a time, I think with COVID, we must learn that we need to really come out of our arrogance also, our arrogance of so-called education or knowing the world and understanding the world. I think that is where we'll be able to deal with disasters much better. COVID, for sure, has been a slap on the face of large number of people, in nutshell.
Thank you, Anshu. Professor Gupta, I wanted to get your response right at the end, because you have a great ability to do analysis of what all you've been hearing, and you have worked on the ground, and you have looked at these disasters also again and again from a very sort of an academic, but also a very on-ground, hands-on experience. I'd like to hear what patterns have you seen emerging?
Thank you. First thing which I would like to draw upon, both Bill and Anshu have said, and others also have pointed out, is that we define disasters properly only when rich and poor are equally vulnerable, not that they're equally impacted. So a flood, a drought, a fire, a disease, when it can affect rich and poor equally, we call it disaster. What Anshu rightly said, that when it affects only poor, it's not a disaster. It's a problem to be solved. This, of course, is not the right approach. But how have societies dealt with it? There are 4 dimensions I would like to share. The first is that where we find a confluence of technology, institution, and culture. Technology is like word, institutions are like grammar, and culture is like thesaurus. We need all the 3 for a sustainable ecosystem. Anyone breaks down, we are in trouble. So what happened in COVID? We didn't have a technology. We still don't have. Institutions, we found institutions working at least in 2 places. When it came to Amphan, Odisha succeeded once again, moving 1.5 million people, probably without a single death. Bengal had 70 deaths. Odisha didn't have a single death. They perfected the institutions for managing. Kerala, fantastic response to the disaster, same country, same governance, and yet such little impact because of institutions. And partly the culture of self-regulation, culture of reporting the problem voluntarily when you have, and therefore going for treatment at early stage. So all the 3 are important, and we must analyze disasters by looking at where have we failed. Did we fail in technology? Did we fail in institutions, institution building? Did we fail in culture? If we don't build institutions, we will repeat disasters. Now let us look at the second dimension. We don't learn from those who learn. We don't learn from those who learn. Kerala learned from Sifa virus, Kerala learned from this, and we are not showing our willingness to learn from them. They have much better infrastructure of health at the primary level, and therefore their ability to involve communities in mobilizing their own preparedness to deal with the problem is the greatest sense or source of strength. Now, what is the implication? Implication is that you engage communities, as Gunj has done and as some other people have done. I mean, nobody will say there is an exception to this rule that without community involvement, you will not have a sustainable solution. It is recognized world over. Gandhi taught us, and we have all been convinced of that. And yet, there's so little engagement of communities in this regard. Third dimension, which is no less important, is creativity of the communities. Communities are extremely creative. You must have seen during the last 1 month or 2 months, people have come out with different solutions to maintain distance. A milk fellow delivers the milk through a pipe so that you don't come close. A shopkeeper has a ramp through which he delivers the product so that you don't come close. Kerala, people use umbrella so that you don't come close. For distancing, and I don't like the term social distancing, the physical distancing for washing, foot pedal, you don't open a door with a handle, you open with a foot. A new design, new concept. All these innovations which are emerging bottom up by people who have not been told to solve this problem. Please understand that the heart of the grassroots innovation movement is people don't wait to be told by somebody to solve a problem. They see the problem, and the first response then the creative people have is, and compassionate people have is, to find a solution. So creativity, compassion, and collaboration. All the three have to go hand in hand to build durable systems to deal with disaster. Disaster is not something that will happen only once. It will come again. We know that with climate change, with increasing complexity, the extreme events are bound to happen more. We have violated all boundaries, be it of bats or humans or animals or otherwise. So when we violate these boundaries, the transition of problem from one system to another is bound to take place. And there is no doubt more floods will come because we have inundated we have filled up all the ponds in the cities and the rural areas. We claim those lands. So naturally, the homeostatic ability of system to be resilient has gone down. When resilience goes down, disasters happen more often, very clear. So I think the lesson to be learned is that how do we increase resilience? And resilience has a double-sided sword. When bureaucracy becomes resilient, that means it doesn't reform. It is so resilient that it comes back to its old style of doing things. That is also resilience. You know, it is so flexible that you teach a lesson and then it goes back into the same shell and has the same inertia. So resilience does not mean that we should remain status quo. Resilience means we adapt incrementally with changes that are coming up. We don't remain where we are. So to the fourth point that I would like to mention is something very critical. What is happening in the drug sector today? We are trying to repurpose old drugs. What do grassroots innovators do all the time? They repurpose available tools, available secondhand parts, and design a new solution. So if you learn from grassroots innovators, then you don't have to search for this. This will be a logical thing. Okay, can I repurpose existing solutions and make them effective in the current disaster? Because new solutions will take time to emerge. And drugs are being repurposed, the tools are being repurposed, the manufacturing facilities are being repurposed. What is so wrong with that? It's so natural to do that. So I would say that grassroots innovators teach us many lessons, and we have not learned to give them voice, visibility, and velocity. If grassroots innovations in you have projects in what, 17, 18 states in the country, or maybe more. And so the child line is also in so many countries. You mentioned 114 countries or wherever. What have we learned from the statewide, the regional child line, regional projects of the GOMS, regional networks of the innovators, regional or local level communities with which we are dealing with? Unless we start now rebuilding society from below, I think time has come to rebuild our society from below through democratic assertion of local creativity, local compassion, local collaboration. And I think that's the way forward.
Thank you, Professor Gupta. That's why I wanted you to speak at the end, because you very beautifully brought it together. And that actually leads me to the next question. I don't know if that's a pertinent question. Somebody asked in the comment section, somebody asked about we need great leadership in the time of disasters. And that leadership in terms of, I'm not talking about the traditional notion of leadership from the government or politicians, but leadership in every aspect of the the people, like I was talking about, the social entrepreneurs who are leading on the ground. And in India, we are seeing India has a very rich history of civil society and social entrepreneurship. And they have really come out and are playing a very important role in sustaining people, feeding people, surfacing the issues and all. So my question is, how do we, like I was saying in the beginning also, how do we actually, what is it that is needed to be done to get all this experience and expertise? And you said we don't learn from the learners. I see social entrepreneurs adapting very fast, improving, from the earlier things, and moving very, very innovatively. I would want to ask, if Anshu, you would want to go and talk about something related to how we have adapted, and then I'll ask Patrick and Bill, and come back to Professor Gupta to bring it together.
I think one of the big asset which the civil society or the social entrepreneurs have is the direct connect with the community. They are much nearer to the realities of the world, right? And in a country like India, as I always say, that it's like a lab, right? I mean, we all enjoy the diversity. We all keep talking about the diversity of the country, but whenever you talk about the development issues here, this diversity becomes a much bigger problem if you do not localize the solution, right? If you like one example which we have been giving, that what kind of food people eat in South India and what kind of people eat in North India are two absolutely different kind of food. So and that is where the dignity and the relief or understanding the issue really come up. So the great thing about the civil society sector is understanding it and the capacities and the capabilities to take risk. Even today, if you see, when you list the COVID warriors, we do not list the civil society people there, right? I mean, we are talking about all other sectors, but we are not talking about civil society people, because we have just taken it for granted that civil society people are meant to take care of people without any equipment, without any knowledge, nothing at all. So if there is an earthquake, they will go. So on one part, there will be the forces who are trained very well and they will deal with the earthquake. On the other part, people like us will go and we will deal with the earthquake or relief, and we will take all kind of risk. And this is what I see in COVID also across the globe. And India is one of the best example of it, that in the last 2 months, after the lockdown, I can say that the biggest part of solving the hunger issue is actually taken care by the civil society, social entrepreneurs, social activists, leaders, and the common citizens of the country. And they have taken all kind of risk, right? And I think that is a leadership. I can tell you, the audience here about how we did. We actually, we are known for our hub and spoke model, right? I mean, that's what we do. We create a center, we collect a lot of material, and then we reach out to people. This is something within first 3 days, to be honest, we changed the entire operation, the way we operate. Because we said that this is something where we cannot create a center. We actually have to reach out and localize the purchases so that we reduce the human touch. We reduce the burden on logistics. And that is how in the last, say about 6-7 weeks, we've been able to create that network of 250 partner organizations and reach out almost 1.2 million kgs of material. Why? Because we trusted, we valued the local wisdom. Because we understood that it is not the leadership of Goonj or any other big, so-called big institution sitting in the city. But what is needed right now is also the leadership of the grassroots, because ultimately they will deliver it. And they understand that area much better. They understand what people need, from where you can source it. How does the local politics operate? Who are the local opinion leaders there? Which is the best possible way to transport material? What do you locally produce there? What kind of financial phases people are going through? How many COVID positive, negative, whatever cases are there? Every single thing was actually known to the local people. So if you value those leadership positions of the local institutions, and just do not start calling them some small, tiny community-based organization and all, and value them that, they are the people who are actually delivering everything. And we are just maybe working like a catalyst. I think these are the roles which many of us really have to change and take up. And I again go back to my answer to the first question, Mini, which you asked, that the most important part is that how people like us throw away our arrogance for some time and surrender and say that we all can grow together. Because as I can give some simple example. Some of you must have heard. I call it like a havan. So in India and in this religion of Hinduism and all, there is something called, whatever you call it, it's called havan, which is basically a holy fire, and where a lot of things actually make this havan possible. So I always say that this particular work which all of us try to do, whether with COVID or without COVID, it is like a havan. So when you do the havan, whether it is wood or matchbox or ghee or havan samagri, every single thing has its own value. Right? It's not that the wood is much more precious than the ghee or havan samagri. All of them have actually exactly same value. So the day the matchstick has this arrogance, and the matchstick comes and says that the havan is happening because of me, that means the matchstick does not remember that if the fire happens without a havan, no one likes that. You put water, you put blanket to doze you off. So the day we talk about the collective thinking, collective leadership, complementing, supplementing each other, I think that is the way forward. That's what we did. That's what a whole lot of other institutions did. That the day you say that the time has come for decentralization of certain things, valuing local wisdom, I think that's the way it goes on. And I think in the last 2 months of dealing with COVID, I think we have learned a lot as an institution, that how powerful is listening, if nothing else.
Thank you, Anshu. Patrick, Bill, would you like to have a go at this question, and then I'll go to my next question for all of you.
Sure. I think it's obvious that in terms of a disaster, whether it's a one-time disaster for a certain period or a continuous disaster, it is very important that the different stakeholders in the process are working together, and they all have a certain added value. So if we mention social entrepreneurs, civil society organizations, or government bodies, what we very often see in our own network of child helplines is that somehow they should try to work together in terms of sharing their knowledge, because each of them, they have their own expertise, and to bring that together could make a big difference in responding to disasters, but also in being prepared for a certain disaster. I also think that data in our network is very important, to collect certain data and to learn from it, to be able, if a certain disaster occurs again, that you will do it better or differently. And all your actions should be anyhow based on facts and data as much as possible. Another, maybe third component, very important for all stakeholders, is the technology that is being used and innovations that are being promoted. In our network, for example, of child helplines, we now are developing a technical platform that will help children and young people to contact the services more easily. So not only by means of a call center, not only by means of voice, but also by means of chatting and messaging, emailing and what have you, which is far more accessible to children and young people all over the world. So by looking at technology where you have to work together with a social entrepreneur anyway, and where you have to work with your members, in this case child helplines, you create a new reality, I would say, that could create a better response in terms of when a disaster is taking place.
Sure. I think those connections, those helplines, are the last mile, sort of lending a hand or reaching out to people, which plays a very crucial role. Thank you. Bill, you have something to share about your experiences or what you've been seeing for civil society's work and social entrepreneurs' work in the last mile in disaster scenarios.
I've been spending the last 10 minutes trying to figure out how to jump out of the panel square and into the audience square, because I think I have a lot more to learn from this group of people than I do to share. So I just love this conversation very much. I think what I would like to do is go back a little bit to something that Anshu said, which is, when you think about it, it is very important, of course. If you think about the system that we have built, the system that we've built is really some manifestation of trickle-down economics, right? And so we trickle down historically with INGOs, we've trickled down just enough resources from the global north to the global south, not to really solve any problems, but just to keep all the problems tamped down. And if you look at the way many organizations have set their whole system up, they've just become intermediaries in that transaction, if you will. How do we just help export wealth and wisdom from, excuse me for saying this, but from the white world to the brown world, because I think that's kind of the mindset that people have had. Well, the shift right now that's available to us, this tectonic shift that's been going on, is really a tectonic shift that brings the model of Gunj to fruition finally, which is the real source of our power, the real source of our change, the real source of our future is those of us that live together in community. The example that I would use in my country, and I don't want to get political, but it's hard in my country to not get political. We pull out from the Paris Accords, that the federal government pulls out from the Paris Accords for the environment. Well, every major city has decided to stay in. Every major company has decided to stay in. A lot of smaller cities. So really, we haven't really pulled out of the Accords. These cities and these different companies have decided we're going to stand for something, right? So if you take the model that Anshu's describing here, which is a new kind of a black box that has so much more promise and so much more hope, then the thing that I always think about when I think about leadership is, so what is the question that we put into that black box? What is the question that we pose? Because the question, when we talk about leadership in this new model, when we talk about what servant leadership really means, it's not that you have all the answers, it's that you know what the right questions are. So as we go rapidly into disaster response and we try to fix things, the real question isn't about how do we fix things, but how do we shift things. The real question to put in that black box is not how do we recover, it's how do we reconceive. And so I think this is the opportunity here, is that when we bring people together, when we arm them with information and tools so that they can build their own future, the real question that leaders have to bring to bear is not, okay, what is the quickest path to recovery? The real question is, what is the smartest path to reconception? How will we reconceive this model going forward so that we begin to, in a way, model for the rest of the world how this should be done? You've heard me say many times, Meenakshi, that the greatest way to herd cats is cat food. And so to me, when I see what is possible, what Gunj is doing in small villages and in rural areas and things like that, that becomes the model for the future. Just as the people in the United States, for example, that have been paid the lowest, that have worked the hardest, are the new heroes of our society. A person who will deliver your food to you, a person who will clean your bed in a hospital. Those are the true heroes of our whole society. and they've been completely swept away until we suddenly have to think the unthinkable, right? So to me, this notion of what Professor Gupta and Anshu and Patrick are saying is, we know that we have to start with the people. We know we have to start with the people that are most impacted, are in the best position to help create a new reality. But our work has to be to help them create a new reality, not to just recover and get back to the same old reality. So I hope that makes sense. I'm rambling a little bit, but I think this model of leadership is what is so crucial and sometimes what is so lacking.
I think that's what we're trying to sort of understand. Where are the gaps? And I think we are even within COVID, we are seeing multiple disasters happening. Just to be able to talk about that. But I wanted to come back to your point about these people who are at the lowest paid and they're doing the biggest service. And I want to come to Professor Gupta about you've been walking the villages of India, and they are the people who get badly affected by floods, by droughts, many natural calamities, and yet they've come up with the most innovative ideas for problems that the world faces. What has been your learning, and what would be your sort of one recommendation or a policy thought process for the world to actually understand about these people, and then next time, or better responding to the disaster by including their thought process?
As you know, the subtitle of my book on grassroots innovation is "Mind on the Margin Are Not Marginal Minds." And I strongly believe in it, and I'll continue to believe in it for the simple reason that I'm surprised and never fail to get surprised by the solutions that we come to see from people who you didn't expect to solve those problems. So we were we have been doing walks in different parts of the country, Shodhyatra. So I have walked in every state of the country, from Andaman to Kashmir, and many states twice or thrice. So we were in Bastar, a region which is conflict-prone, regions where extremist ideology of the left as well as the conservative ideology of the right, both are colliding for some time. And we saw in one of the villages, after walking in Narayanpur sometime, we saw some graves. And there was no Christian there, there was no Muslim there. So we asked people, why do you have these graves? Sir, when a healthy person dies, we cremate. When a sick person dies, we cremate. When a healthy person dies, we bury. So how can you offer to Mother Earth a sick body? And this continues till Gadchiroli. We were in the last before year, we were in Gadchiroli in Maharashtra. There also they have the same practice. For about 200 square mile zone, this practice continues. Very eclectic culture, a culture which has combined the concept of cremation and burial together in the same life space. So one of the things that we should learn is that diversity is the heart of resilience and coping with disaster. The moment you have uniform response, you have now superimposed another disaster on the disaster. So uniform approach to deal with a problem is a disaster. That means you're refusing to look at what is called as long tail of innovation. If there's a garden and you have only one kind of flower, you may not go there twice. If there's a garden, there are 50 kinds of flower, you will visit it more often. Diversity is the soul of sustainability. And yet our bureaucracies are so difficult, find it so difficult to deal with diversity. Be it the problem of migrants, be it the problem, just imagine the lockout started and we said, stay home. Now someone who has to earn every day and eat every day, how will he stay home? For how long will he stay home? So he can use his savings inventory that he's already having 15 days, 1 month maybe. Second month, what would he do? What would he eat? So it is anticipatable that there are pockets of frustration because people have not been able to earn and therefore not been able to eat. It is anticipatable. There's no surprise in it. Now, if we do not pay attention to such diverse experiences of people in a similar situation of disaster, as in COVID case, then there is a disaster. This is a disaster that we ignored these diversities. So I would say one lesson that we all need to learn is the sustainability is in diversity. Second thing, sustainability is in dignity. I remember when you had explained to me a long time ago, and many times I've attended your programs, that, you know, even when you give resources to poor, let them earn it by doing work for it. So Cloth for Work program, for example, was an example. This time we did an experiment on Food for Knowledge program. There were about 700 migrant laborers whom we were trying to feed. And I told my colleagues that, look, we will make food as a feast for learning from these migrants. They have knowledge, which only they have. Food can be bought in the market, but knowledge cannot be bought in the market. My colleagues tried, it didn't work. So I went. No, I'm supposed not to go out because of my 65 plus age, but I did violate this principle. I went there using all precautions. And I talked to the laborers and I said, look, when there was a whitewash going on in my house once, a person cut his head. He went out and came back after a few minutes and his hand was not bleeding anymore. So I said, what happened? He said, I have used the cow webs, the spider web. And that spider web has coagulated my blood. Now, if you go to net and you search literature, you will find so many research papers on the coagulation property of the blood by spider web. This person has not done any research. He has empirically tested it out. And there are a large number of such solutions. So sitting in my presence, these laborers from Jharkhand, Bihar, UP started telling their stories of how they solved problems when they had no other resource. Now tell me, a poor person has very constrained environment so far as material is concerned. How will he or she survive? Obviously through experimentation, obviously by leveraging mind, not money. Because that's the only thing he has in abundance. He has in abundance his mind, not money. So you leverage the resource in which you are rich. Poor people are rich in mind, they may be poor in wealth. And disasters, the response to disaster has been, and your experience shows that, have been more sustainable in areas where this principle was understood, that diversity, dignity, and decentralization, all the three are critical. Because as you mentioned, Anshu has just mentioned that there were about 200 odd groups with whom you could get together in the fund and get things done through them because they know local conditions. Now, there is also a downside to it. The downside is that many times the local politics affects the fairness of the distribution. And there you need to bring sometimes third parties, a group of elders, for example, who will oversee like a social auditing mechanism. So in disasters, we also need social auditing, where people who are respected by the society are given this responsibility that please oversee and tell us whether we are going wrong somewhere. Are we? Now, this is one thing which we have to enforce at all levels. Let me conclude by saying this issue. There are 4 A's which can help us wrap up what we have discussed in the last 15 minutes. Access, assurance, ability, and attitude. You have access to resources. That is, you provided access to resources. And I have no assurance that I will get them again when I need it in the next fortnight or what. I'm worried now. If I use it now, I'll get used to it. And how will I cope without it when I don't get it second time? The ability is the skill to convert access into investment. Whenever disaster management has forgotten the skill part of it, the ability of people to rehabilitate themselves, we have had non-sustainable outcomes. Attitude is both endogenous and exogenous. If you make me work for myself, my self-respect goes up. And the most precious resource in a disaster management is self-respect. And I'm sure your work shows it well. Childline shows it. Bill will agree with that. The self-respect of people, how can it go? How can it be restored and sustained is the critical factor. So I think assurance, attitude, access, and ability, all the 4 must be leveraged in a manner that we maximize dignity, maximize diversity, maximize decentralization, so that disaster response becomes sustainable.
Thank you, Professor Gupta.
Can I add, Meenakshi?
Yes, I was going to come to you.
Yeah, no, because I think Bill and Professor Gupta have said exactly those things on which we always keep talking about things. I think Bill, just on your point, I mean the fact remains that every single institution and individual which was ignored by the society, is the most valuable person. This COVID has proved. So if I talk about India, you have seen it. The ASHA worker, the last mile person, is not even paid the salary which most of us pay to our part-time mates. Okay, and look at the beautiful work this lady can do. The government schools, which all of us have seen here, the most ignored schools are the quarantine centers. The private hospitals, the richest possible private hospitals, half of them were not working in this disaster, but every single smallest possible government institution was working. So I think this is also a big question to the political leadership, corporate leadership, voluntary organization leadership, all the leadership, that who needs to be valued more, who is needed. Right? Do we really need more malls and picture halls, or we need to really build more capacities and invest more money in the small, tiny government schools, public health centers? I think this virus must make a dent on our thought process. It should not affect us physically, but it should make a dent on our thought process. Number one. Second, on Professor Gupta's thing, we have spoken, many times, but this disaster has also proved that how we ignore the wisdom of the people. Something which we have been saying, that if people like me and you just add 2 wires somewhere, we call it innovation. And the moment a grassroots person does anything, it is called jugaad in India. And it might get, or I don't know, it must have got some space in Oxford Dictionary also now, because it is such a common word. And so we are actually basically, we are not giving value to that. I mean, imagine we still consider farming an unskilled profession, and we bring that farmer to the city, make that farmer a plumber, and start calling that person a skilled person. So I feel that a lot of this mental or mind shift needs to happen. A lot of this, people like us really need to become much more vocal about it, and we need to bring a change in this entire thought process. And again, I'm saying it's all about lenses and language. That what language are we using? I mean, how long will we value the food but will not value the farmer? So that actually has to change for sure. And this disaster has really taught us a lot, which maybe not that earlier disasters didn't give us a chance to learn the same things, but we refuse to learn. And even after this disaster, we do not learn, we will never learn.
I just wanted to sort of, Anshu, because you are, Goonj is especially sort of working on the ground, and we're looking at, I think the whole point of this conversation was also to look at a more kind of an integrated approach. I think somebody has mentioned that and because Goonj has been working in the cities with many different stakeholders and in the villages, what is your thought on what could be a kind of a more sort of a model or an idea or the way of going forward with the same sort of to make the disaster work in future much better?
I think we need to reduce our dependency on Google. I think that has created a lot of problem now, because people sitting in the city are just Googling about village India. Okay, it doesn't happen like that, and I'm very serious about it.
I like it.
Because Google is like selective learning and reading. Fine, if you type poor farmer, so you will only get the news of suicide and poverty of the farmer. How many of us really type skilled farmer? We do not type. So we only want to read in the language we want to read. I think this is a time when every single citizen who has been inside, their home or house, they need to learn that they could remain inside and safe and are able to talk on these beautiful new machines with the new systems, just because someone who otherwise has been in the queue to receive some ration has been growing food for us. It is very simple. So it's not even about empathy. I am saying that empathy now is a very small word. Let's not talk about sympathy. Was a wrong word. Empathy is a small word. Now it's not even about giving back. It's about paying back. That we all understand the value value of the people and then make everyone a stakeholder. That is the only way forward for me. Otherwise, we are sitting on some other disaster in the time to come, because it's like a curve, right? So it's not that with COVID things are going to stop. COVID itself is a mix of hundreds of disasters. Even with, during COVID, the cyclone happened. Even during COVID, the floods will happen in the month of June and July, and it's still happening in many other parts of the world. So it's just that how do we really get a chance now that we have got a chance, instead of wasting all our time on Zoom calls only.
And the locust attack.
A locust attack, exactly. And the fires in Uttarakhand now across, I mean, it's all going.
Okay. Thank you, Anshu. Patrick, I'm going to come quickly to you, and probably Anshu, I'll come back to you about you in the earlier presentation. You had spoken about GUARD as a model that Boon has been talking about for disaster work. But I'll come back to that. But before that, I want to ask you, Patrick. The people that we're talking about, the empathy for those people that we're talking about. You've been working with children. And that's one very neglected, I would say, a very neglected community, especially in disasters that happens all the time. Even now, we see that schools have been closed across the world, and that's been more or less the end of that matter, in a broad sense of the word. But what would you say has been your learning, and one recommendation, the policy recommendation, you think from their perspective, or how could that change in the preparedness we have for disasters?
Yes, I think that we adults, we talk a lot about children and about young people, and sometimes what we forget is to actually talk with them and to listen. What our members always indicate, and what they first do when a child or youngster is contacting the helpline, is that you simply listen first before you give any advice. And I do think that we can learn a lot from our children and young people, and actually that we should involve them more in all kinds of discussions that we are having related to politics and decision making. So we have this huge thing called child participation, and we are very much promoting it. And also during COVID-19 pandemic, we try to involve children and young people as much as possible, also in coming up with new ideas, because they do have ideas. Of course, we are trying to help children that have worries, that have questions, that are being bullied or that are being abused. And I very often experience, and our members as well, is that adults take over and actually do not respect the views and understanding from children. So I do think that here there's a huge potential of improving decision making.
Thank you. I think youth certainly are left out of the conversation, most of the conversations, and they are in many ways reclaiming that space. I think I want to spend the rest of what we have, about 25 minutes, to talk about, we've talked about the various aspects of disasters and what has been left out not. And I now want to come back to all of you, and you can, any one of you can pick up the question as to what could be the way forward, what could we think of as an action plan. And I'll come to you, Anshu, first. I'll ask you first, because you've spoken about a whole model. You've spoken about a way of doing this in a different way going forward. So I'd ask all of you to look at or respond with a sense of some actionable, some approach, some thought process, which really informs how we do this going forward. So over to you, Anshu, just to get, you've spoken about GUARD earlier on in the earlier sessions of Catalyst. So if you could start off with what you think should be done, or what could be an approach in future.
So in nutshell, because we have like few minutes and I think we need to listen to all, because obviously there has to be an action plan and all of us need to work on this, because as this disaster is not going to get over immediately. So sooner we finalize it, we can work in a much better way. So we just came up just before the COVID, we actually launched something called GUARD, which was basically Goonj Alliance for Rapid Response and Disaster. And the whole idea was that, why do we call a disaster only when large number of dead bodies happen? So these are some of the misconceptions that, if a disaster happens in village part, it is not a disaster. If it affects the city, so Mumbai flood are much bigger disaster than the Bihar or Odisha flood in India. Then when the dead bodies happen, when a lot of deaths happen, then you talk about that it is a disaster. So funny cyclone, because of prevention, people didn't die, but people never understood that it's a much bigger disaster because millions of people actually lost everything. So we said that, the right of calling it a disaster should not remain just with the government or with the media, but the people like us, the practitioners, the common people who are affected by the disaster should also have a right to call it a disaster. And also, why do we start working on a disaster after the disaster? I mean, when we know that there is a flood and the roads are not working, that is where we start collecting material and start transporting. And we all know that roads are not working, there is water. So we said that can we create an alliance and informally, because we have at Goonj and some other institution, but formally the whole idea was a globe, across the globe on certain principles, can we have this alliance that the support is just a click away. So hundreds of these partners come together and one say that the moment a disaster happens, I will actually give away $1 million or $100,000 worth of transport free of cost. Someone says that I make biscuits or I make paste or I make soap. The moment a disaster happens, 2 trucks of my dead inventory or my short expiry inventory or new material, whatever way I want, which is still usable, will come to this particular network. Someone says that I sit with 200 partner organizations all across the country, or I have a lot of knowledge of the water or sanitation or desilting of water bodies. So I am a part of this network, and the moment a disaster happens, I will activate my network and get it done. Right? So if we create this pool of disaster, to be honest, in the world like this nowadays, you actually then do not have to wait for a disaster to happen and then work. We will still have our continuous work, which will really go on. But that way, the suffering or the relief and all, or the response will never be delayed. Because right now what happens is that a disaster happens, it takes a day or two to register that the disaster has happened. To be honest, lockdown, we all understood the displacement disaster when we saw some pictures on the road. For first couple of days when people were going hungry, we were not even understanding that. So that is one way of doing it. The larger thought or dream behind that is also that we will be able to update people with the right kind of knowledge about disaster and the role each one of us can play as a stakeholder, not as donor, beneficiary, and all those useless words, as I say. As a stakeholder, if we can really become a part of it.
So if I was to just summarize what you're saying is that we are looking at GUARD is about basically committing our resources beforehand, and also collaborating between the wisdom of the communities and the first responders and the other stakeholders, whether it is the industry or other stakeholders, to work collaboratively beforehand and be in tandem, in work in synergy with each other to be able to respond at the time of a disaster. That's what you meant by clicking on the click of a button, that when a disaster happens, our responses happen, right?
Absolutely.
Okay. Professor Gupta, you have, I can see you have some clear thoughts and actionables to offer for going forward.
Yes, I think first thing is to reverse the globalization. We have had large corporations, long supply chains, distant production and consumption. All of this need to be reversed. We need to have smaller supply chains. We need to have local production and consumption systems. We need to decentralize society in a very fundamental way. So you must remember, as a management scientist, I can tell you 40% cost of a product that you pay for is actually in transportation and in logistics. Now, if we can start decentralizing our production and consumption, Ila said, can we consume 70% of our things from 100 miles? She wrote a book on that. And I think that's a great idea, that if we can try to consume more and more locally, it will connect our lives, life of consumer with life of producer. And as much as possible, we should try to connect them. So that is one policy, that every city, every large town should have spaces where people can come and sell their craft, their food, their things, and consumers can buy directly. So the connecting producer and consumer directly is one very clear policy guideline that emerges, and we must do that. Second thing which emerges is that rich and the poor, privileged and the less privileged must have some institutional role where they will sit together and solve problems. The shared spaces are the cared spaces. Shared spaces are the cared spaces. The role of common properties is so fundamental. We have stopped sitting together. You talked about Google. I mean, when do we sit as a community, as a neighborhood to say, okay, can I make our housing society the most efficient in water conservation or in sanitation? Now in Surat, you know, there was a group which made, every household made 5 rotis separate, 5 bread extra, and they fed a whole lot of migrants by putting 5 bread extra. So I think we need to encourage local solutions. Local common property institutions must become the hallmark of future budgetary investment for creating space for rich and poor to come together. Earlier, there were ponds, there were pasture land, there were grazing lands, there were, you know, different kinds of common spaces which were maintained by people together. Those things have now almost been privatized or have been statized. So I think we need to come back to the cooperative model of governance in as many things as possible. That is second thing. Third is, what produces local solution? A kind of a local lab. What is lab? Lab is where people experiment, find some solutions work, some solutions don't work. We have to keep this lab in readiness form. How do we keep this lab in readiness form? By providing risk capital. You know, microfinance was good for goods and services for which market exists. Microventure finance, which we suggested in 2003, is for goods and services for which market does not yet exist. People made different kinds of masks. People made different kinds of other tools. How do people made immunity, food for increasing immunity, using local herbs and local plants and so on. We need to provide risk capital to communities to come out with their experimentation for readiness for the next disaster. If there's a crisis, let's say Saidullah Saab in Champaran made an amphibious cycle. Not one cycle was bought till date. We have floods in Eastern India, but rescue officials do not have an amphibious bicycle, which he invented in 1973. And we gave an award to it. And he got President Award. Did cycles get made, manufactured? No. So all such technologies which can go directly to help, technologies and services which can help in disaster management, in flood, in drought, in other places, there must be risk capital available to invest in them in large enough numbers, at least for local community experimentation and use. Fourth is, we realized that in 2001 earthquake, that the first line of defense for any disaster is the neighborhood people. And the hammer and the pickaxe were the most important tools, and a cutter. Because when the houses fall down, you have to take the people out of the bodies, have to be taken out. They are still alive, you have to take them. Now, do we have inventory of tools and processes that are required for managing disaster at local level? So we suggest that we should make a DMIS, we tried in 2001, Disaster Management Information System, where at local level, you should have available tools and techniques that are available with people. We should know how many retired people of fire brigade, for example, live in the next 50 square kilometers. So if I know all the people who have worked in fire brigade, they are trained to deal with disasters, right? Now, we don't have an inventory of these retired people, but they are they are the best competent, most competent person to deal with disaster. So we should have inventory of skills, tools, techniques, and institutions which can cope with a disaster, and people can volunteer. I can work within 50 kilometers, I can work in 100 kilometers, I can work in 500 kilometers. Who can contribute to that? And finally, I would say that the point which was very well made by Patrick, that listening, you know, we must have a whole chain of listening, learning, leveraging, linking, creating networks, knowledge networks, social networks, and finally legitimizing. This is the process of policy change. The last step is legitimizing. When policy gets made, where people say, all right, the communities will have to work with their neighborhood, all the service providers. You know, you have Thanksgiving in a Western society, you have Thanksgiving festival where you take your secretary or staff for dinner or lunch. We should invent such rituals where for one day in a year, at least, we will provide dinner and lunch and offer to our service providers, to the sweeper, to the guard, to the gardener, to all of these people. We should invent such rituals, and they are required so that at least one day you will be listening to them. You will be learning from them. You will be leveraging their ideas to make society better. You will be linking them with other providers of services, and you will legitimize that process. So I think we should make very significant changes in our education system. Our education should increase samvedana. And I will take a half a minute to mention for those who don't understand the word samvedana. Sam means equal, vedana means pain. When I feel somebody else's pain as intensely as that person feels it, it doesn't remain that person's pain, it becomes my pain. Sarjanshilta, creativity emerges from samvedanshilta. Empathy is for others, samvedana is within. That's why empathy is not the right word, Anshu, as you rightly said. Samvedana is the right word. So let us think of how our education system becomes more samvedanshil. Cannot we do that? All the migrants that have gone back to the villages, can we not make every single school to have rooftop water harvesting structure with underground water storage structure? These migrants have built multi-story building in which I and you live. They can't build the overhead tank. They cannot build underground tank. So let us think of a very clear policy. First time in our country, at least in India, and I would say that other countries have similar situation of reverse migration in one or the other way, highly skilled people have gone to decentralized, have gone to the rural areas. Can we use their skills for rebuilding our society? A society which is distributed manufacturing, distributed consumption.
Thank you, Professor Gupta. I'll come quickly to Patrick in terms of any action thoughts about how to go forward and what could be a kind of integrated approach to disasters coming from your experience.
Well, I think that the guard concept from Anshu is rather interesting, but also the many L's that Mr. Gupta mentioned, starting with listening, is a very interesting concept. Of course, my reference is still my network and child helplines, and maybe as a step forward in presenting an action plan and recommendations to policy makers and decision takers. I think it's again very important to emphasize the access to services in an integrated way, so that we can talk about really in this case a child protection system, and also linking this somehow to the SDGs, the Sustainable Development Goals that we somehow try to catalyze and to speed up to 2030. A subject that is very important, mentioned by many of our members, is around ending violence against children. And I do think that this can be further prioritized by getting more data around it. Evidence-based advocacy, campaigning, to put this really on the agenda of politicians, for example, and to improve our protection system, because one of the SDGs is, to be very exactly, 16.2, which is about ending all forms of violence against children and young people. So if we really respect all these points that have been mentioned, I think we can really make a big step forward.
Thank you, Patrick. Bill, I'll come to you now. I think I missed maybe mentioning that you also head Resource Alliance, and Resource Alliance talks about different resources and how are we managing or leveraging or deploying our resources in disasters. So what would your action forward be in terms of how do we deal better, going forward? Bill?
Sorry, I was saying, as I always do, I'm going to philosophize a little bit before I get specific. But I think
we have less time. I'm just gonna warn you about the time. Just
yes,
that bit. Yeah.
Understood.
Thank you.
And I think that you know, when I look at what Professor Gupta is talking about, we have to decentralize. In some respects, what we have to do is we have to shift our mindset from one sort of magnetic pole of power to a magnetic field where, in a way, the process of decentralization is actually a process of reconnecting people to where the power in the world has always existed, which is in individuals, in small communities to make things happen. And so to me, I find it very compelling. Governments hate risk. NGOs hate risk. A woman farmer tending 1 acre of land lives in risk every minute of her life. She is the person that has no conception of fear of the things that most people are afraid of, which is failure. She must survive, she must strive. So to me, when I think about the question of policy, I have to be honest with you, I don't think policy ever does much. Policy rarely creates success. At best, policy can see a model of success and turn it into progress. But until we have that model of success framed, no policymaker will know what to do. So, you know, I think we first have to establish that model of success. That is the profoundly important thing. And I believe that model, showing what true decentralization means, showing where the real power lies, is in the villages of Bihar, is in small rural communities where people come together and create a marketplace to trade their goods. This is something so profound and so powerful. So when I look at GUARD, this new concept of Gunj, I think that GUARD creates a concept for doing this a new way, and I endorse it enthusiastically. I think the true success of a GUARD program will be how effectively we split between two different types of decisions. One is 50% of our time should be spent on how do we recover, and 50% of our time should be spent on how do we reconceptualize. How do we rebuild and reframe so that we become a model for how this is done? I am 100% certain that the source of the new way forward, the point of the digital revolution, is a series of small actions and small ideas can blow up to be world-changing in their import. And so to me, it is not what the system or the government or anything else is ready to hand down to the people. It is what the people are able to model for each other, and the government and the policy and everything else will follow that. And I think that's where our work really lies, is not so much in policy, but models of progress that then policy can follow. So to me, this is not rocket science. In fact, we could create small experiments and fund those experiments massively as long as we're asking the right questions of the right people, and amazing global change will happen. That's the power of the internet, is there is not centralized communication, but completely networked communication, completely networked example setting. And I think that's our opportunity. Focus on small, make something beautiful and brilliant happen, and then make the world understand its import.
Great, thank you. I think the whole point about reconceptualizing, I think that's a very important point. And I think we have, I think in various different conversations across the world, there's been this talk about let's not go back to the old normal. Let's try and create a new normal or create a new way of doing things. I just quickly want to sort of see if I can take one or two questions. Anton from the Catalyst team has a poll that he wants to do before we close the session. But before that, I thought I'll just take a quick question. I think there was a question from, I think there were quite a few questions. I'll just pick up, I'm just trying to quickly look through it. A question from Manisha saying that how can grassroots creativity, innovation, and problem solving be surfaced up at a scale so that they influence and drive solutions at a systems level? Does anyone want to have a go at that question?
Well, I would say that there is no need, the center question should be rephrased. How do they surface is not the problem. How do they get recognized as the problem?
Okay.
Solutions are taking place. Otherwise, they wouldn't survive. Their survival is a proof that they're experimenting and innovating. What is lacking is our ability to map these. So I think databases should become a very strong recommendation. Databases of the ideas, of the practices, of the institutions, of the solutions that have worked better should be made together, should be made into a viable tool for people to cope. So we must have, we have honeybee databases. For example, Honeybee Network has many databases which are in open source. So that is one recommendation I will make. Second is that walking and immersion in the societies where we want to work with, staying there and living with them or walking through those places in their life conditions is also another way to learn from the people and recognize their creativity. And third, most important that we have found is children. That through children, if you challenge them, they are still not corrupted. Their mind is pure and innocent. If they are given a challenge to learn and look for oddballs, people who are trying to find solutions to the problems in their own way, they do a great job. And I'm so inspired by the fact that we can learn so much from children and their creativity. So I would wish that we invest more time in harnessing the creative potential of children and their ability to spot the oddballs or odd things in society and around them than only on other channels of learning from the society.
Patrick, would you want to have a go at this? It talks about the data aspect of responding. You heard my question.
Not very well. Maybe you can repeat it. I had some internet problem. Sorry.
Well, unfortunately, even I have an internet problem here. Somehow the whole the chat aspect has gone. Vikramjit, if you are here on the chat, would you like to unmute and ask your question directly to Patrick? Can anyone else see that particular question and repeat it? Because unfortunately, I somehow.
No, but that's amazing that in the last 3 minutes there is a tech problem. Otherwise, it went up pretty well, so not bad.
But feel free, Anshu and Bill, to answer the question. I mean, I can try to look it up, but.
Can anyone else read this here? If Vikramjit, the person who asked, I think it was Vikramjit. I think, Anton, can you help Vikramjit? He's trying to unmute and he's not able to.
I think I can repeat the question if I'm not mistaken, because Dr. Gupta reframed it, which is how do we find a way to bring light? How do we find a way to highlight or to show the world what progress is being made at a very small community level? So how do we blow that up, if you will, to show the rest of the world what can be done?
No. Bill, the question was that I'd gone to the second question. I was asking, and I think I might have been on mute or something. I think there's a question from Vikramjit Ghosh who was asking that, Patrick, you had made a point about collecting and using data. In the context of Bill's earlier point around a less transactional approach, would any of the panel members have suggestions on how we can use and access data more effectively from their experience?
Okay, that's actually a question to the other panelists then.
Well, you can also respond to that, but also other panelists, if anyone wants to have a go at it.
No. Well, maybe just to highlight again the importance of data for the network. It is the gold, as I said before, of the network. It is important in this case that you have the right definitions about data. It all starts with defining categories and subcategories, for example. And then secondly, to have a tech platform technology in place to collect the data. And then thirdly, you will need to analyze it in a thorough way and present it in an evidence-based way in some kind of report to do some advocacy or campaigning. So we as a network, we do try to improve each of these necessary components in data collection. We now do it, for example, only once a year, which is a very big exercise. With all the countries in the world, these 142. But it is quite a challenge. And what would be really interesting to have in the future, some kind of a real-time monitoring system where you can identify trends, in this case, the welfare or the well-being of children and young people from a day-to-day basis. That would be my dream.
Thank you. Patrick, thank you so much.
I can offer just 10 seconds on this, because as an electrical systems engineer, data is a big deal to me. And I think
Bill, I'm so sorry, but there's only 1 minute left for the, what we're going to do is we'll have all the,
don't let him complete. He's an engineer. His engineering has come out. So I think we need to listen to him.
Very quick, I'm going to say
I just wanted to say that we are going to come together as a core group, putting all these recommendations and thoughts into a policy paper, a 2-pager that we are trying to create. And I've asked, and I'm so sorry, Bill, that we're coming to the close of this. We barely have time for doing a poll to figure out how people can input in it. I hope you'll forgive me for this, Bill. I am going to request Anton to do a quick poll. We want to have inputs from all the people, and this core group will come together to put in all the recommendations for the larger world to understand as to how we can be better prepared for disaster response. Here's a poll. If you can quickly mention the dates which work for you, we'll try and incorporate that and come up for the next round of discussions on this. If everyone can just mark their own preferences, and we'll be able to move on and decide.
Yes, thank you very much. Already all the ones who took part in the survey, we have 17 out of 23 at the moment. At the moment, it seems like we are looking at June 17th, but we will communicate this further. And I also wanted to thank again all the speakers. It was a fantastic discussion. And I think afterward, we'll create the core group and take all the information from the respondents who want to share important learnings also to the core group. I think this would be best. So reach out to
so much.
And also to the panel. Yeah.
Thank you. Thank you so much, everyone. Thank you.
Thank you.
Cheers.
Thank you.